Okay, so this is going to be about all the different treatments that occur after an injury, injury happens. So that's ice or heat. Am I going to put an electric stim on it, or all these different things that can be used to care for these injuries, especially in that immediate stage. But it does continue as we go through the rehabilitation process. There is a handout on the exam 2 portion of the portal. And so the best way to do this is to print that handout out and then, kind of follow along and fill it in as we go. If not, you can just take notes and kind of just follow along from the video itself. As we talk about the first ones I talked about, when you get injured, you have this, do I put heat on it? Do I put cold on it? And so we'll go over that. On the handout, you see I've created kind of this little template, like a little chart that we're going to fill in. And so it's pretty straightforward. So when you get injured, the typical response when you get injured is to put ice on something. And so as you go down, usually heat and cold are opposites, right? So that's going to be pretty easy. So when we talk about temperature in the tissue, heat definitely increases it. Cold definitely decreases it. When we talk about metabolism, we've already talked a little bit about decreasing metabolism with cold right there for the acute, right, to slow down the metabolism and less oxygen, less secondary cell death. Circulation tends to follow the same way, right? So circulation is going to go up with heat and it's going to decrease with cold. The pain tolerance is where it's a little bit different. So pain tolerance, both of these, increases basically the pain tolerance that we have. And so this is the way that you can just fill out this little chart by just increases and decreases. That's all I really need you to know. The next portion of that is this therapeutic, this concept of therapeutic outcome. And so as we talk about therapeutic outcome of heat and cold, now I'm just giving you some pictures. This is a diathermy machine that gets really, really deep heating. And so there's all these different kinds of pictures. But when we talk about therapeutic outcome, from a heat side, it really is able to make the tissue much more, I guess, flexible. We call it extensibility as we talk about it. So how much can we move? Since we have more blood flow, we get more oxygen delivery, so that's good. But it does increase the inflammatory response. So we are going to get that vasodilation in the acute stage. That may not be the best thing that we want. We want to limit the swelling, so that's what the cold is going to do. Limit swelling. It definitely helps with some movement, so it gets a good numbing version. We can do some exercise with that. When we talk about pain, remember, both of these have the same effect on pain. It actually increases the pain tolerance, where there's a decrease in pain as we go through. On your sheet, you see a number of different types of theories about how pain works. Pain is physiological. It's also mental. There's a mental component. And so the first thing that we talk about is this gate control theory. And on there, I think I have kind of a list of bullet points on there that give you the basic components. And it's this. Basically, when we get pain that comes in from our shoulder, it goes to the spinal cord and up to the brain, and then we go, oh man, that hurts. So that's what this is. We just have nerves that conduct the pain signal, the physiologic signal, to the brain, and we perceive that. The spinal cord itself is only so big. So if we have a whole bunch of neurologic signals coming in, then there's only so much that can get up there. So it's kind of like an elevator. When you have a big busy elevator and you have all these people only a certain amount of people can go up at one time. That's the same thing with the nerve impulses. When it gets to the spinal cord, it's trying to go to the elevator, and this elevator, you come up to the elevator and you see this, you're like, I'll take the next one. I don't want to cram in there. And that's kind of what the gate control theory is based upon. This concept that there's only so much room in our spinal cord. So here's the big things that you need to write down. Our sensory information, our touch, heat, pressure, all of those kind of sensory stimuli comes in on these really, really big nerves. Here's our spinal cord. We're in the spinal cord right now. It comes in, goes to this little spinal cord, and then goes up to the brain. The bigger, faster nerves carry the sensory information, where the slower nerves carry the pain information. And so that allows basically the bigger nerves, as if you stimulate both of these at the same time, the bigger nerves and the faster sensory information will get to the spinal cord and basically block out or close the gate on the pain nerves. And so this comes out where you stub your toe or you get a pain, and immediately if you apply some sensory information or some sensory stimuli, like I'm going to put some pressure on it, you grab it, you press on it, you hold it, you rub it, you do all these different things, it can reduce the sensation of that perception of pain. The pain's still there. There's still a nerve impulse going there, but because of this gate control theory, it doesn't get up to the brain as quick, and so we're not perceiving that pain as much. I'll talk a little bit more about the gate control theory if you have some questions. It's pretty straightforward in the bullet points. But I'll go over it in class when we have a chance to. The other theories that are there are this endorphin theory, that basically what you see here is the pain is getting up to the brain, and then because the pain might be really, really intense, there's an impulse that gets sent down from the brain to kind of the endorphin stuff to block out pain, especially like if we're running through flames to get our child, and we don't feel the burns until after that process is over. The other one that goes under the cold side is this nerve conduction velocity. Nerves, produce this or send impulses at a set speed, and cold is going to slow that speed down. So the slower those impulses get to the spinal cord, the less pain that we're going to perceive. Then we get into this, when do we want to use heat and cold? And so that brings us to the next part on your handout, is this term contraindications. It's not a hard word, but some people will get confused and they'll see this word. You need to know what it is. I'm not going to ask you what the definition is, but what I'll do is I'll ask you, what is a contraindication for using heat or for using cold after an injury? And basically, as you look at this, contra means no, right? I'm not going to do that. And the indications means that yes, I would do that. So these are situations when you would not do heat or cold, right? So this is a situation where all that list that you see on your handout, the contraindications that are there are basically the times that you would not use heat or cold. And so basically, crossing the train tracks, when you see this, the lights come on or the bar come down, that's a contraindication to continuing to go across, because you might get hurt, right? As we talk about, and this should be all in your handout. It should be there. It's the same information that's there. The only time that that acute swelling is not a contraindication is that's actually an indication for using cold modalities or ice. All of these other things, if we're going to start doing a bunch of sensory information, if we have poor circulation, poor sensation, then we don't want to do these. And that's kind of the same thing as we go down for all of those. When you see the bar down, that means a train's coming. That's a contraindication to, doesn't mean you're automatically going to get hit by a train, because sometimes you could sneak through, but sometimes you need Hancock. And that's just the way it is. All right. The last little bit is the side effects and the sensations that you're gonna feel. For heat, it's pretty easy. The only worry that you're concerned about is, if it's too hot, you can get some skin burns. The cold, you're definitely going to feel this stinging, aching. Eventually it gets numb. It may feel even burning sometimes. That's this nerve palsy where you get this kind of this numbness and you can't really move very well. Some people do have a reaction to pain, and they actually get hives and other things. That becomes a contraindication if that's the case. So then we go to the handout. And so for all of the different types of cryotherapy, thermotherapy, I want you to be able to just look through there. I've given you all the information you need to know. I want you to kind of pay attention on basically how do we apply it? Advantages, disadvantages are going to be a big one. Time. So if we're talking about an ice bag for 15 to 20 minutes or an ice massage for 8 to 10 minutes, what are the advantages of using an ice bag as cryotherapy versus a whirlpool versus all these kinds of stuff. So go through there. Those are the kind of things that I want you to focus on. Is focus on those advantages, disadvantages. When you get to the whirlpool, make sure you look at the whirlpool temperatures. I may ask you those. And then the same thing with that or the analgesics. Make sure that you understand that mechanism of action. It's basically the gate control theory. I'll talk a little bit about that in class, but I just want to make sure you have an idea of all these different types of, I got more pictures. I got all kinds of pictures of these analgesics. The final part of this video is some other different modalities that we can use that can be used to stimulate healing or to help someone with that kind of stuff. And I just picked two common ones. There's all kinds of them. I picked ultrasound and electrical stimulation because those are very common. The information that I need you to know on this ultrasound is basically a deep heating, and so you can see that if you do continuous sound waves coming out of there and you're moving that around, it definitely creates the heat. If you do a pulse where it just comes out every like 20% of every second, it gives a quick little pulse, it won't heat as well, and so you do get some healing effects that occur. So that's the big thing I want you to know. The indications, contraindications are usually the same as heat. Around the bony areas, that sound will bounce off the bone and kind of irritate the bone. And of course, the metal, if there's metal implants, plates, screws, that kind of stuff, the sound will bounce off that, and that'll vibrate, and that'll cause some pain as well. So same thing on the effects. It's the continuous is heating, and the pulse is that more of a healing effect. It stimulates the healing process. For the electrical stimulating currents, I basically just want you to kind of have an idea of what we use them for. And the goals is a good way to say that. Electrical stimulating currents are good for decreasing pain, especially in the short term. This is another picture of the gate control theory. If you want to talk about stimulating a bunch of sensory fibers, that is a bunch of electricity tingling that comes in there, blocks out the pain. Easy. And so a pain control is a very common use of using electrical stimulating currents. Problem is, when it goes away, when you turn it off, in about 20 minutes, the pain comes back. So it doesn't get rid of it totally. The other common one is to do muscle contractions, and we use that in rehabilitation. You can see a good picture here of some pretty significant atrophy after a surgery. So we want to help build that back up, help get some of that neural inhibition or that contraction back going as we go. Once in a while, you'll see some healing properties that are discussed, and that's a little bit less consistent. It's the pain control and muscle contractions and what we can do with those, very consistent. The healing properties and stimulating the healing process can be done. It's just not as consistent. That's basically what I want you to know from this handout. I'll talk a little bit. We'll have some time in class to talk about that kind of stuff, but I want to end this before it gets too long.